Hello, 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 hello. Good evening, fellow friends and loved ones. Yes, once again, it's a very great privilege and an honor to come to your homes to continue our weekly discussions. Yes, by the grace of God, the first quarter has come to an end and we began the second quarter. It's the grace of God, yes, nothing but the grace of God. Today is the 4th of April 2021. Yes, and I'm sure that we all went to church. And a happy Easter Sunday to us all. Christ Jesus has resurrected from the dead again, and then He's alive within us to seal the victory that He has won for us on the cross of Calvary. Yes, thank you very much for your time, and I don't take it lightly for that. And so, thank you very much. So, this evening, the flyers went out throughout the week on a very important topic, and I'm sure that you all are interested and very keen to listen to this topic. So, without much ado, we zoom into the outline and then we begin the discussion. So, outline is a topic in discussion, the definition, the clinical relevant anatomy, the epidemiology, that is the statistics around the condition, the causes, be it mechanical, hormonal, be it in the body, and then we talk about the psychosocial risk factors. We're going to talk about the clinical presentation, how this condition comes about, the onset, the pain, how pain relates to this condition, other conditions that look like the condition, that we can take them out and then diagnose this condition as such. Yes, and then examination and which tests that we can conduct to be able to arrive at this condition very specifically. And then treatment, physical therapy, medical wise, and then we'll look at some red flags, that is other conditions that when you have, you should take very caution with this condition. And then we look at the prognosis, that is what will happen after you have this condition and how likely you're able to recover from this condition as best as possible. Okay, so thank you very much. So before we begin, as we know, we give ourselves a quote to meditate upon and to ponder over. So the quote for this evening's presentation is from a man called Vincent Van Gogh. Vincent Van Gogh, yeah, I'm sure you know that he's not from Africa because it doesn't look like an African name. So he said that normality is a paved road. It's comfortable to walk, but no flowers grow. So I repeat again, normality is a paved road. It's comfortable to walk, but no flowers grow. You can continue on it. Yes, so we just want to know that anything that we do in life, we shouldn't take it as normal as possible, but we should try very hard as best as possible, and we should know that yes, with God and it, yes, we will be as best as we can. Okay, so this is our quote for the evening. So we zoom into the topic for today. So today's topic is entitled pregnancy related low back pain. Pregnancy related low back pain. So what is pregnancy? So I'm sure we have a fair idea of what pregnancy is. Yeah, so pregnancy is actually as a result of a male and a female coming together and then having issue, that is intercourse, and then the baby coming into the womb, that is the male sperm and the egg coming together to form a baby, and then the baby grows in the mother's womb in the stomach. There's a part of the stomach region just below the stomach, so we have a place just below the stomach region called the womb. The womb is where the baby sits or sleeps in and grows gradually and becomes as big and as functional as possible, with eyes, with nose, with everything like a human being. And then after a period of 9 months, yes, the baby comes out through a canal called the pubic symphysis. So the pubic symphysis is actually a structure in the genital region that opens up when 9 months reach. Sometimes it doesn't get to 9 months, but then the baby comes out early, and then he or she is referred to as a premature baby. sometimes he or she keeps longer in the womb for more than 9 months and comes out. There are other complications that come with it, but then we are not talking about that today. We are talking about pregnancy related low back pain. That is, during pregnancy or after pregnancy, there's a likelihood of the mother having back pain, and then we are going to trace the various causes of the low back pain and how we can treat them both medically and then as physical therapists also. Okay, so what is pregnancy related low back pain? It's a low back pain that affects mainly the back region during pregnancy of a pregnant woman. So you see that pregnant women mostly have their stomach big and then having complaints of, oh, my back is paining me. I'm sure if you're a lady and not pregnant now, statistics have shown that most ladies who get pregnant tend to have low back pain because of the increase in weight as a result of the baby in the womb. So they are likely to have an awkward posture, that is the posture being tilted in the wrong direction, and this will have impact on the muscles at the back and then cause pain in the lower back. So actually the pain that is complained about is basically found at the 12th rib. So when you say 12th rib, it's actually when you put your hand towards this region downwards like this, you feel there's a bone that ends, there's a bone that goes. So if you are watching, you can just put your hand here and go down and then tuck your hand inside. You feel a bone here and go down. So at the end of that region here where my hand is, you can feel a bony structure there, and around that structure is the 12th rib. When you treat the 12th rib right back into your mid back, that is your back, there's where your hands will go and meet together. There is a point where there are some bones that are aligned at the back, and they are called vertebrae. So the vertebrae, we have the one at the neck side scientifically called the cervical vertebrae, the upper back called the thoracic vertebrae, the lower back is called the lumbar vertebrae, and then just beneath getting to your waist region, we have something we call the sacral vertebrae, and then inside the buttocks region we have some bones there called the coccygeal vertebrae. But we are talking about the lumbar vertebrae, the one at your mid back region. So around that side, when you put your hand here and move around to the tip at the back there, we meet some of the bones called the lumbar vertebrae. And then at this structure, around this structure, we'll have something we call the spinal cord. That is where there's conformation transfer from the brain right to that structure called the spinal cord. The communication for us to move our hand, for us to walk, for us to talk, for us to even go to the washroom. They are all connections. Without these sensations, it will be impossible for us to even move, and then it will be hard for us to carry out our activities of daily living very, very effectively. So this structure called the lumbar vertebrae is very, 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 very important when we talk about pain that is involving pregnancy. Okay, so it's actually the pain from the 12th rib, around the 12th rib region. So it goes down. So at that point where it will hit, it down into your buttocks region, the whole region from where when you hit like this, from here, goes backwards where your hand goes to hit, right down there, all the bones down there. I'm sure we'll be seeing some pictures of it very soon. We'll see some pictures very soon. And so the spinal cord goes right down to your waist region, and it ends around that side, and there's a structure we call the cauda equina. Yes, it ends there, and then there are small nerves that go down into your legs. So your right leg has a portion of the nerves, the left leg has a portion of the legs of the nerves, and goes down to your knees and then to your toes. These are our communication lines for us to be able to perform our function as a whole being, that our legs are connected to each other, and our brain and everything working together. Okay, so this structure, I've mentioned something called the buttocks region, so the gluteal folds. That's where some of the the bones are found. That's the coccygeal bone and the sacral bone, sacral vertebrae. Okay, so this actually pain could be around the back region, and then could go into the buttocks region and go into the thigh region and go down into the legs. Yes, and per research, it has shown that some women are likely to experience it quite early. Some people also are able to experience it after they give birth. So the reasons will be explained to you very, very soon. So this condition, actually, there are so many names for it. I'm sure most of us have nicknames. Yes, you have, someone can be called Kofi Inti, and then if you say my name is Last Stop, my nickname is Last Stop. My nickname is Hairbrush. Yes, so my nickname is so many nicknames. The same thing, this condition called the pregnancy-related low back pain has other nicknames. We will have general low back pain, or we can have peripartum posterior pelvic pain. We would have also pregnancy-related pelvic girdle pain. So these actually are similar, though they may mean differently as we talk about this condition right now. Yes, okay, so we talked about the anatomy, that is the structures found around the back region and the neck region. We are concentrating on the back region. So at the back, we have structures we call ligaments. Ligaments are very, very strong structures that connect the bone to bone, and then without ligaments, our bones will shift and be shifting up and down. If our muscles cannot control our bones like our ligaments, our bones are very, very tiny, and so they are small ligaments that are very, very, very precious. In fact, God created them as very, very precious to hold our bones in place. Immediately one is weak, then other compensation takes place, and then this could cause the bones to shift, and then it can even cause the spinal cord to move into so many directions. This can be actually as a result of aging, as a result of trauma, accidents, and so they could shift. But then in this condition we're talking about, low back pain, it's mainly attributed to the pressure or the weight of the baby that is forward, so it causes the mother to push. So if the mother is pregnant this way, the baby pushes the mother forward, and then causes the back muscles to become a little bit weaker, and then they push the body forward. And so there's something we call abnormal curve at the lower back, which under normal circumstances is supposed to have a small curve at the lower back, but then because of the weight of the baby and then the mother's compensatory mechanism, that is for the mother to be able to balance her activity and work well, there's this increase in curve at the lower back, and this increase in curve causes abnormal presentation, that is abnormal restriction of the lower back, and this could cause the low back pain in pregnancy. And so the ligaments begin to overstretch or become shortened, and then the other structures, the muscles, become shortened, and when they become tight like that, they cause pain, and the pregnant mother could complain of pain. Okay, so we talked about the ligaments, and so we will be talking about the epidemiology. But before the epidemiology, just some of the ligaments names. I'm sure they might not be so necessary, but anytime you hear of them, just know that they are ligaments. We have the ligamentum flavior, the ligamentum interspinator, we have the ligamentum intertransversarum, and so many ligaments just at the back. And we have one very strong muscle at the back called the lamborum muscle. Yes, very strong. And we have the erector spinal muscle. These are muscles that hold the back in place for us to move and for us not to sway to one side or to the other side. So these are very important notes of these structures around the back. So when we talk about the epidemiology, that is, what are the statistics, what are the research carried out of this condition? One, it's shown that about 89% of women have low back pain. That's the back paining them during pregnancy. About 89% of them. That is a research carried out outside. And as for Africans, I'm sure quite a little more people will have low back pain because of the body structures. But I beg to differ. So we'll delve more into the causes or the percentage wise in Africa, or specifically Ghana. So 89% of people, that is women, have low back pain during pregnancy, as research has said. And then it's shown that about majority of them have it during the third trimester. So what do you mean by trimester? Actually, pregnancy takes 9 months to for the child to become a full-grown baby and come out. So scientists have shown that every 3 months there is a particular body structure that the baby or the fetus, that is the baby that is not come out yet, is supposed to have. So at the third month, the baby should be able to have the brain not really formed fully, but to have the legs coming to form, the eyes, the nose, the mouth, the ears actually forming like a baby, and then the back forming. And then from the 3 months to the 6 months, the child should be able to have the organs forming, at least to about 60% of them. And then from 6 months to 9 months, the baby is supposed to fully form, at least to the ability to breathe, ability to have to talk, not really make talk but make sounds, and then to be able to have ears to be able to hear. And so within this 3 month intervals, we scientists have named it trimester. Tri means 3. So it's shown that mothers or pregnant mothers tend to have this low back pain, that's the pain at lower back, at the last trimester, that's the third trimester. Is because the baby has been fully formed and then has probably weight. Just imagine the baby is 2 kilos. I mean, just imagine holding a 2 kilogram rice and walking throughout the day with it. I'm sure you have pain in your hand. The same thing is for the pregnant woman who has carried the baby for 9 months. Just imagine 9 months, not even 1 week. So let's note that this pain actually is something that is common. So in case your wife has low back pain, yes, don't take it for, don't say, oh, we are complaining too much, my my back. Yes, but it's something that is likely to happen, it's bound to happen. So, and there are treatment protocols for this condition, and so let's take note of it. So mostly the mother or the pregnant mother complains of discomfort, and actually it starts from the 5th to the 7th month, that is getting to the between the second trimester to the third trimester, but then it's fully evident in the last trimester, that is between 6 months and 9 months. Okay, so what are the causes of low back pain in pregnancy, or pregnancy related low back pain? We are actually about 4 major causes, but one is known as a mechanical cause. That is where we have weak structures in front, and then the back structures, that's the lower back structures, tend to compensate to avoid the weak structures becoming too much weak. Okay, so at the front part we have some structures we call the stomach muscles, that's the abdominal muscles, and these structures helps us also to keep ourselves upright, and also compensate in terms of keeping our lower back also very, very, very stable. But then when the baby is conceived and the baby gets older and then goes in the womb, the stomach muscles, that's the abdominal muscles, become weak. Very important muscle around the stomach region called the rectus abdominis muscles, and becomes very weak and stretches. So the moment it overstretches, it can't come back to its normal form as early as possible. It's not elastic. Every muscle, that is this muscle, not every muscle, but this type of muscle around the stomach region, is not elastic. When it's stretched, it doesn't come back to its normal place again, but then it becomes loose, and then you could see that during pregnancy, after the mother gives birth, you see that the mother's stomach becomes still big. It doesn't come to the normal place again, but then it's realized that there are so many ways for returning the mother's relaxed stomach, at least to keep it as strong as possible. Okay, so during pregnancy, the mother's stomach muscle stretches, and then the structure at this part of the muscle, this part of the body here, called the linea alba, and this structure keeps the stomach, this side of the stomach muscles, this side of the muscles, and connect them into place. So this structure, this thin structure we call the linea alba, is a structure very strong to keep the muscles in place. So as the mother gets pregnant and the baby grows in the mother's womb, this structure stretches and opens up. So just imagine the baby opens up and the muscles stretch out. So this structure called the linear arbor breaks out and then becomes weak, and then this connection between the two side muscles is lost. And so after the mother gives birth, you see that the stomach doesn't come back to normal stage again. But sometimes that's a few percent of people tend to have their muscles return back to the normal, but majority of women tend to have their muscles weak. And then moreover, if they have about 5-6 children, just imagine with all of them having different weights, it can be very, very, very disheartening. But we're not talking about the muscle structures in front, but the muscle structures at the back that cause the low back pain. Okay, so the low back pain actually is as a result of the weak structures in front. So when these structures in front of the muscles become weak, the muscles at the back tend to become tight to be able to prevent these structures in front from pushing the person forward. Just imagine you are working with these muscles so weak, you're likely to fall down and then even kill the baby. So the pregnant mother's muscle at the back becomes tight to hold the baby in place for this period of 9 months. And so when these muscles become tight, they could cause the bones to compress against themselves, and the spinal cord, the nerves tend to become so uncomfortable, and then the whole being becomes uncomfortable. So you know that some mothers, when they get pregnant, when they can't sleep at one place, they just turning, their back is paining them, always complaining. But then the husbands or the wives should take into consideration and understand them. Yes, it's not their fault, it's just a period of a stage of life, and then it will be fine. They'll be fine. Okay, so these are the mechanical cause. We also have the hormonal cause. The hormonal cause, this is as a result of there's a structure in the body that's a hormone called the relaxin, and then this structure causes the ligaments at the back to become so relaxed, and then this could cause the body to shift inside. So the back muscles shift inside and cause something we call hyperlordosis. That's the back muscle shifts inside too much, and these could cause pain at the lower back called low back pain or pregnancy related low back pain. There are other causes aside the mechanical and then the hormonal causes called circulatory causes. Actually, this could be as a result of expanding of the uterus. Yes, so when the uterus expands, the circulatory cause. So when the uterus expands too much, the uterus means womb. So the womb, the scientific name for uterus is called womb. So when it expands too much, yes, it could compress on a part of the heart called the vena cava. The vena cava is a very, very important structure that takes oxygen from the lungs right into the heart. So then, if there is compression of this structure called the vena cava, then it could result in discomfort, and then it could result in the patient waking up from sleep. Yes, and then it doesn't allow the patient to sleep enough, and then the patient wakes up on and off. And these actually cause increase in fluid volume during pregnancy. And this compression around the vena cava region, that's the heart region. So the heart is at your left side. So when the womb becomes so big and then compresses on that structure called the vena cava, that's a part of the heart, it causes something we call hypoxia. That is reduction in oxygen level into the heart, and then there's less of enough blood into the structures around the back, and this will cause low back pain or pregnancy related low back pain. So this is one of the circulatory factors that cause low back pain. You have the mechanical we've talked about, we have the hormonal, the relaxin, and then we have the circulatory, that's the compression of the vena cava around the heart region. So when we look at these three factors, we have one more factor called the psychosocial risk factor, and this is actually result of the pain severity around the low back region, and then also the person could be so depressed that it could cause reduction in amount of blood supply to the low back pain region, and then extra stress. So when the patient, even in pregnancy, stresses herself, continues working, overworking, it will cause too much pressure at the lower back, and this will cause pregnancy-related low back pain. Okay, so as we talk about the causes, that's the etiology, we'll talk about the risk factors. So what are the risk factors that causes pregnancy-related low back pain? One, laborious work. When you say laborious, it's a scientific name. It's just a big name. It means overstressing yourself. Even if you overstress yourself, you could cause low back pain. That is when you're pregnant, when the woman is pregnant. And also, if the woman has a past history of low back pain before she got pregnant, there's a likelihood that there could be a recurrence of the low back pain again when the woman is pregnant, because then there'll be too much stress also at the lower back. So let's also take into consideration the tendency of having low back pain during pregnancy when you have already had one before pregnancy. Also, there's also the likelihood that the person or the mother has got lower pain during pregnancy, and then the mother has given birth. When the mother conceived again, there's a likelihood that the mother will have low back pain again. These are research that has been carried out outside, and then there's tendency of you having the low back pain. And also there are also pain syndromes that impacts the abdominopelvic region, that is the abdomen, that is stomach region, and then where the genital organs are. There are structures that we call the pelvic girdle. It's a bone which will be shown very soon that holds a baby throughout the 9 months, and these bones are very, very strong, and then they hold the baby in place. And then when it's 9 months, there's a structure in the pelvic girdle called the pubis symphysis, which opens up for the baby to come out. These are all planned by God. Yes, so we want to thank God for that. Yes, so other risk factors are also as a result of multiple abortions. So those who do abortions a lot, you're likely to have pregnancy related low back pain when you're ready to give birth. Also, if you have a past history of low back pain, yes, you could have it. Okay, so other ones are also called smoking. So if you smoke a lot, you're likely to have low back pain. Yes, so women who like smoking, in fact, smoking is very, very bad. It could affect your lungs, it could affect your heart, but also it can affect also your low back, which could cause low back pain. It could also affect the baby. So let's all stop. In fact, let's stop smoking if you are pregnant. Also, a number of pregnancies that you have, if you give birth to 6 children, the 7th one, there's a likelihood that you could have a low back pain. You also have periods of amenorrhea. Amenorrhea means when you have your menstruation stops. So if you have a longer menstruation stop of, you could have a low back pain. So women who have passed menstruation period, that is postmenopausal period, that is those women who are old and don't menstruate again, they're likely to have low back pain, because then the hormone that's supposed to give strength to ligaments there, it's also absent or is in its reduction or low form. Also, we also have increase in workload. That is when you have too much workload, you would have low back pain. And also high body mass index. This research has this point is actually being proven wrong, but then we are still stating this topic, this point, high body mass index. Sometimes you could be overweight or you could be obese, but then your body structures could be so strong to maintain this component around your back, and then you could have no low back pain during pregnancy. But then the research states that quite a larger number of people who have a high body mass index, that is, they are obese, tend to have this condition. So we state the fact as such. And also lack of exercise. So even if you're pregnant, there are exercises that are very, very important for you. We'll be showing to you very soon the various accepted exercise program for pregnant women. And also those who lead sedentary lifestyle, those who like to sit at one place for a long time, they can sit down the whole day at one place. And then some of them, it's not actually their fault. Some people, like the market women, which God willing, I'm not saying, but I'm just chipping in one thing. God willing, tomorrow we'll be having a very, very interesting and open talk around at the marketplace. So the topic is a marketplace education. The marketplace education. We'll be having that Rollins Park in Accra. So let's take note of this, and then let's all partake in that, and we'll keep you updated on the progress on the Facebook page. Okay, so we talk about sedentary lifestyle. So if you sit down for a long time, you like to have low back pain, and moreover you are pregnant with a baby and overweight. Yes, so all these factors could cause an increase in the severity of the pain at lower back. Okay, but as I said, being overweight doesn't really have a direct relation with your low back pain. It could be that the back will be very strong to bear the weight at your back, and including the baby too. So we've talked about the risk factors, but now how do this pain present at your back? Very, very, very importantly, we mentioned the fact that the pain starts between the 5th to the 7th month of the pregnancy, and then it peaks at the last 8-9 months of pregnancy. So these are actually researches that have been carried out to indicate that one may have low back pain around this period. And pain is actually usually intense during the evening, because then there's reduction in supply of blood to the body regions, and then there's less movement which the body, that is the muscles and ligaments, tend to contract very, very less frequently, and so there's a high tendency of pain during the evening. And then the onset of pain, actually, as we've been stating, it peaks at between the 6th and the 9th month. Okay, that's between the 24th and then the 36th week, very, very specifically. So pain actually, it states that pain, from the research, states that pain can spontaneously disappear within 3 months. That is, patients having, that is, chronic pain. So just at the pregnancy, which has stated that the pain can disappear just like that without any cause. But then people also who have this condition, that is the pregnancy related back pain, tend to have this pain persisting even after 3 weeks or 3 months. And so let's take note of it, and then let's understand women who are, after pregnancy, they complain of low back pain, but then there's always a treatment for the low back pain to minimize it, and then most importantly to treat it for the patient to return back to its normal. Okay, so as we said, also another research stated that 67% of women experience pain in the night. 67% of women, I'm stressing on this very important point. 67% of women experience low back pain during pregnancy. Yes, so the husbands, please understand your wives when they say they have low back pain in the evening, and then let's give the best support as husbands as possible, and let's understand the women. Okay, so some factors that cause the low back pain during pregnancy is one could be standing, so long standing and then prolonged sitting, and also some women also have the low back pain being intensifying when they cough. So coughing also can trigger the low back pain and then increase the intensity. Sneezing, walking, that is too much walking, and straining the body, and then performing abdominal movements such as twisting motion. So twisting like this or like this could cause malalignment, that is abnormal position of lower back, and this will cause low back pain. So actually this pain actually can be mild, that is very, very small, and also can be moderate, that is a little bit intense, and can be also very severe, where the mother finds, or the pregnant mother finds difficult even taking walks. And so let's take into account this variations in the pain intensity. Okay, so it's shown that in terms of the mild or the moderate pain that is experienced by the mothers, just about 20% of this pregnant mothers experience this mild to moderate pain intensity. Most of them experience the intense part. So let's look at also the pain aspect of this pregnancy. Okay, so the location of the pain is very important before treatment, because if the pain location is not really located, then the treatment can be cost 90. Yes, the pain can also be very deep. So if the patient complains of the pain being deep, then the patient also complain of the pain moving from here to here to here to here. There are other diagnostic procedures that, as physical therapists, we are able to assess and then treat the patient as best as possible. There are other pain around the back region and then the genital organs region, that is where we have the pelvic girdle. That could look like the pain. So when the patient says he has back pain, we don't just, as physical therapists or as medical doctors, say, oh, this person has low back pain. But as physical therapists, we are very important in terms of assessment. We will see whether there's pain at the back or at the pelvic girdle, and then we treat them accordingly. So when the pain is at the lower back, the patient complains of the pain being dull, aching. And then also, if the patient's pain is around the chest region to the back region, that's the mid-back region, the pain can be burning. So if the patient complains of burning pain, we don't say it's pregnancy-related low back pain. It could also be as a result of pain around the mid region. And so there are other descriptions of pain that the patient will complain upon, of which could be shooting, that is like it's pricking, it's shooting, like and then also feeling the pain being sharp pain. Okay, so one also important point we should note that pregnancy related low back pain is actually dull aching, and then it's always, the pain is pronounced when the patient bends forward. So if the pregnant woman does this, the pregnant woman has the pain intensity increasing. This is as a result of this mechanical increase or stretching of the lower back muscles. So as we said initially, that the pain that is the muscles at the back become short and become very tight to be able to hold the front structure, that is the baby, and then the muscles in place. So when you bend like this, the shortened structures begin to overstretch, and this will cause tears around the muscle structures, and then also it could cause malalignment, that is changing positions around some structures we call the intervertebral disc, the bone, the nerves, and this could cause pain around the lower back region. So the patient complains of the pain being dull. Okay, so also as physical therapists, also we have something we call palpation. So we palpate, we use our finger, our thumb to press on lower back, and there's a way of pain coming out, the patient experiencing pain, that could show that the pain is actually at the lower back. So you can check a structure around the lower back called the rectus spinae muscles, and these, when we press on as physical therapists, could cause pain around the lower back. So other conditions that look like pregnancy related lower back pain. So some of the conditions, I'm sure you've heard about it, sciatica. I think now in Ghana, one of the very name that has gained a name in this country is sciatica. Everywhere you pass, you hear sciatica. Yeah, so this condition, when you have it, could look like pregnancy related low back pain, but then they are not the same. They are similar. We have also myalgia, paraesthetica. We have the thoracic rib pain. We have the hip pain. We have the coccydynia. We have the spontaneous abortions, osteomyelitis. We have osteoarthritis. We have Cordell-Quina syndrome. We have so many metastatic cancers. We have these diseases, facial joint diseases. So many conditions that could look like pregnancy related low back pain, but then we are going to rule out them when we do a very comprehensive assessment of this complaints made by the patients. We also have various diagnosis procedures. We have diagnosis tests. We have something as physical therapists called provocative tests. So we do this to be able to get a very, very firm conclusion on our diagnosis as we are thinking of. So we have other tests that, as physical therapists we use. We have the Patrick Faber's test, and I'm sure I'm not going to detail about this test, but then these are all tests that helps us to arrive at a very definite conclusion of this condition. Okay, so we mainly concentrate as physical therapists on the lower back. Yes, we go through tests to be able to firmly conclude on the diagnosis. So this actually pain impede, that is prevent the patient from carrying out actively living very effectively. Even carrying bucket of water or carrying even a slightly heavy substance becomes very impossible. So we need to recognize certain red flags very early. Red flags are something that they are noticed, which should prevent us from carrying out various activities or carrying out various tests. Okay, so aside this test as physical therapists, we also have other tests by the radiographers or the radiologists, which helps to conclude upon our our impressions or what we are thinking about. We have the MRI scan of the lower back and also the CT scan or an X-ray of the lower back to be able to see exactly what is wrong at the back. If there are other conditions that we can rule out, we've mentioned other conditions called osteoarthritis, so many conditions, so that we can treat them, either rule them out or treat them together as a whole. We have something we call outcome measures. These are various questions that, as treatments are going on, we ask the patients, and then we're able to help to see the progress of the condition as time goes on. So we have a very, very comprehensive examination procedure as physical therapists that we are actually obliged to every patient to go through, so that we can firmly conclude on the diagnosis. So we have observation, we have assessing the posture, how the patient is standing, whether it's standing curved, whether it's standing in the wrong posture or the back is shifting forward, and then we're checking how far the mother can push forward or braid the leg forward. And then these are all examination procedures as physical therapists that we go through, um, and this helps to be able to diagnose this condition as low back pain. The one very important test is something we call the Thomas test. So if the patient sits down in a chair and then brings one leg backwards and then raises the other leg, that's it, straighten the leg and raise it up as high as possible. So in the process of raising the leg upwards during the sitting position, the patient complains of pain around the lower back region, and this could mean a positive indicator for low back pain. This is called the Thomas test. Aside this test that we do, we are able to firmly treat this condition. At least the pain goes down with time. Yes, the pain could take about 6 weeks. It could take lesser depending on how severe the pain is, and also how functional the person is after treatment. So if you are being treated and you go and do the same thing you're doing, you don't expect that the pain will go down. But we advise patients to minimize treatment as best as possible. So how do you treat this condition called pregnancy-related low back pain? First, we have the medical way of treating this condition. We have medication that we can have taking analgesic, that's this paracetamol, tramadol. These all help to reduce the pain, but then it's very important that we go through physical exercises to strengthen the back and to relax the structures at the back very, very well. So we have, as physical therapists, we have something called posture reeducation. We educate the patient on being in a very good posture. We have stretching exercises. This exercise actually is done between the second and the third trimester. The first trimester, if you have low back pain, it's advised that you reduce movement and then no exercise. You're not supposed to do any exercises in the first trimester. Between the first month to 3 months, no exercises are recommended to be done for the pregnant mother. This is a very, very important point that we should note. Any exercise done between the first, second, and 3 months of pregnancy is not supposed to be done. Yes, this is very important that we should take note of. After 3 months, 4 months to 9 months, there are structured exercises that when you see your physical therapist or your physiotherapist, you can be able to get the right exercises done. So I mentioned something I call we call red flags. So if the person has a vaginal bleeding, that's the bleeding around the vaginal region, no exercises are recommended. We have to see the medical doctor to be able to see what is going on in around the vaginal region. Also, if you complain of dizziness, or you're feeling the tendency of fainting, or you feel like you're about to faint, this is also very important that we stop any exercise, we don't do anything. Also, if you feel like your breath is shortening, you feel like you're having breathing difficulty, you also have, if you have chest pain during exercise or during activity, no exercise is recommended. If you have intense headache, and also if you have weakness in your muscles, also if you have swelling around your calf region, that's your leg region, if you have swelling around the side, you're not supposed to do any exercise. You're supposed to hold on. And also if you have uterine complications, so if you have the womb complications, you also have to stop exercises. If you have also vaginal fluid leakage, you also have to stop exercises and then see your medical doctor, or the physical therapist will direct you to the medical doctor to be able to assess you and see what's going on. And also if you have neurological symptoms, also you feel weakness around any part of the body, we will refer you to the medical doctor to be able to assess and then see what is going on in your internal structures. So what are the goals of physiotherapy? So as physical therapists, it's very important that we educate and then the patient on how to prevent worsening of the condition, and also to improve the functional ability of the patient. Also, it's very important that the patient understands the condition and appreciates and does the respective exercise that's supposed to be done by the patient. Okay, we have other exercises. We have the manual therapy techniques that we teach the patients to do. We also have spinal manipulation. We also have active exercises. We have so many treatment procedures. We have using a device we call a TENS machine, transcutaneous electrical nerve stimulation machine, which helps to reduce pain. And also we have stretching exercises to stretch the lower back and also improve circulation and relax any stiffness around the lower back. Okay, we have also aerobic exercises, that is group exercises that are done for the patient so that we can get the patient functional as possible, and then be able to carry the baby throughout the 9 months. It's very, very important. It's very, very, very important. Also, home exercises also are very important, which we engage the pregnant mothers, and then they're able to cooperate, and then their delivery is also very, very free and then very, very successful. Okay, so if you're pregnant and you experience low back pain, you can see the physiotherapist, especially when you're in your second trimester, that's from 4 months going to 9 months. Any physical therapist or physiotherapist will be able to give you exercises to strengthen your back and also strengthen where the baby will come from, so you can have a very, very good delivery. So we talk about the prognosis. Prognosis means what are the good prospects, what are the good signs of recovery after you have a condition we call the pregnancy-related low back pain. So it's shown that after some few weeks, persons with this condition return to normal function, the pain gone, with exercises and then with warm therapy, and when with the right posture, yes, and then it's shown that they return to activity as best as possible. But about 8% or 10% of people tend to have their pain prolonged even to the 2-year period after delivery. So let's take into consideration also, if you have this pain at your wife has delivered and has pain at lower back, even after a year or even 2 years, it's acceptable. But then there's a very, very good treatment protocol by the physiotherapist which can minimize the pain and then take the pain away. So it's very important that we see one to be able to treat this pain and take them away. Also, there's lifestyle modifications also that helps to prevent the pain, that is becoming aware of yourself, that is minimizing carrying heavy things, and then ensuring that you're in a good position, especially you don't turn and a very bad push position. If you want to turn, you turn fully, you turn the whole body fully, and also you eat well. Yes, eat well during pregnancy. It's very important. I'm sure dietitians are very, very, very strict about this, and I'm sure there are dietitians also watching. Yes, okay. So, without much we do, I'm sure we've had a long session. This condition actually could take even hours to talk about, but I thank God that at least we were able to finish this condition. And if you have any questions, if you have any suggestions or comments, we can bring it on board as we look at the pictures and then we come to an end. So let's look at some few pictures before we come to the end of this wonderful discussion. Okay, so so this is what we talk about. Yes, so you can see this exercise done by this mother. Yes, so we call it the cat and camel exercises. So we should be seeing a very, very comprehensive one after this. Okay, this is how the pregnant woman's back is. So you can see there's a line being drawn, yes, at the lower back. I'm sure we can see it from that side. Yes, I'm sure you can see it from that side. So let's look at it very, very, very well. You can see the line here. You can see the arrow to there. Yeah, so you can see the arrow here. This arrow, this is a normal back alignment. Yes, and because of the weight of the baby, it's pushing the back inside, and you could call something called hyperlordosis. That is over pushing of the back muscles forward. Okay, and this will cause what we call the pregnancy-related low back pain. Okay, so this is a very good structure of the pregnant woman. You can see the baby inside there. You can see the back here. These are the bones here. That's what we call the vertebrae. These bones are called the vertebrae, and these are called the ligaments. Ligaments. Okay, these are called ligaments, and these are called the muscles. Okay, so this is also a lower back pain. You can see where the red is where there's pain in the lower back. Okay, so these are some of the exercises that can be done after pregnancy. After pregnancy. Okay, so this is another one. It helps to stretch the back and then also return the patient back to its normal function. So this is where the pain is, the lower back. Okay, this is some of the exercises that will be done by the mothers after pregnancy. So this helps also to strengthen the back and then to take off the pain. Okay, so this is what I was talking about. Yes, this is the cat and camel exercise. So the mother pushes the lower back inside and then pushes the lower back up. So as the stomach is going up, the head is going down. This one, as the stomach is going down, the back going down, the head is going up. This helps to stretch and to strengthen the back and then to return the back's alignment back into normal position. So this is the lower back. Okay, so this is some condition of lower back in the pregnant mother. So this is the where the baby sits. The baby sits here. This is called the pelvic girdle. This is a muscle that helps to hold the baby in place. So the baby sits here. So these muscles expand, and this structure at this point is called the pubic symphysis. What I'm pointing here now is called the pubic symphysis. When the baby is matured after 9 months, this pubic symphysis opens up to allow the baby to come out, and then the baby is born. So these are some of the exercises that the mother goes through, the pregnant mother goes through. That is after the first trimester, from 4 months going to 9 months. Okay, so this device is called a TheraBand. So the mother pulls it forward, it pulls it backwards, and helps to strengthen the back. Okay, so these are some of the exercises. This is what we call the Thomas test. So when the mother does this and there's complaints of pain, yes, so a person could have lower pain. So this is also the so this is a bone. This is the ilium bone, then the sacrum bone. This is the ilium bone, and then this is the pubic symphysis, there's a structure here called the pubic symphysis. It's a muscle that opens up, a structure opens up for the baby to come out. Okay, so these are the pictures. Okay, the pregnant mother. So walking is also a very good exercise for pregnant mothers. Okay, so let's see some few pictures and then we come to an end. This is also an exercise for the pregnant mother called the pelvic tilt exercise. So the mother puts one hand down there and puts one hand at the top there and raises the lower back up and down. So the buttocks goes upwards like this and the stomach goes in. So these are some exercises for the pregnant mother. And then also these are the bone structures at the back. Okay, so the pregnant mother. Okay, so some of the pictures. Okay, so this is what I was talking about, the Patrick Fibers test. So if the patient has pain with this, what the therapist is doing now, there could be a sense of pain at the pelvic region, and as physical therapists we treat them as such. So these are the anatomy of the back muscle. So this is the mother with a baby, born baby. Okay, some of the exercises. Okay, so wow, what a wonderful day. Yeah, it's been a very, 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 very long discussion. Okay, so just let me show you some interesting picture before we end. It's very interesting. Yes, so you can see the pregnant mother doing the exercises there. Yeah, you can see the exercise there. So you can see the so these are some of the exercises that as physical therapists we go through to teach the pregnant mothers. This is called the gym ball. So you can see the pregnant women doing the group therapy there. Okay, so you can see these are some exercises the pregnant mothers do. Very simple exercises. Okay, you can see them. This is a yoga pose. I'm sure you've heard about yoga before. And these are some of the exercises that they do. Okay. All right. So, wow, it's been a very, 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 very wonderful time. Yeah. I'm sure I'm also sweating. Okay, so thank you very much for your time, and I'm sure we had a very wonderful time. Okay, so without much ado, any question, any suggestion, any contribution? Yes. Okay. Any question? Right. Without any question, we zoom into our next topic for next week. Next week is the 11th of April, and I'm sure you join us in our discussion next week. Also, kindly share the flyers for our next presentation to your contacts, or the links also to your contacts, so that they also join and then enjoy the discussion. You can't enjoy the discussion alone. Okay, so without much ado, our next topic for next week is osteomyelitis. So if you want to know about this condition, let's keep up the flyers spreading out. So let's share the flyers. Okay, thank you very much for your time. I'm very, very honored for your time. We spent about close to 55 minutes, getting an hour, but it's worth the discussion. Thank you very much. Have a blessed evening. May the good Lord be with us all. And then a happy Easter Monday. And then if you can, let's pray for us as we have our outreach tomorrow. And I'm sure that